Mathebula, it's always a pleasure to talk to you. Thank you so much for your time and good morning to you. I suppose let's talk about it because it seems some teachers and even teacher unions may be split over this new policy. But what is your reaction as the Commission?
Greetings to you and greetings to your viewers out there. Thank you for having me.
Absolutely. And your view, your reaction to this. Where does the Commission stand with this policy to report teenage pregnancy in schools?
Yes, the policy for us means a lot because over years we've been monitoring issues of teenage pregnancy in schools. We have been working closely with the Minister of Department of Basic Education. We have worked with SACE to look at the issue of underage pregnancies in schools. So basically for us, it means that we need to really support the new policy and monitor its implementation in terms of the fact that we want all students, female and male students, to remain in schools before and after pregnancy. And I think this issue is so important to us because it's not only an issue that speaks to violation of human rights, but also it's an issue that also speaks to issues of socio-economic impact or implications that it has on students or learners, but also it actually perpetuates the cycle of poverty and the early school dropout. So these are some of the issues that we are looking at from a human rights perspective.
Right.
But the policy also means that, there is an issue of an age consent, especially if you are below ages of 16. And it also begins to really nip the issue or the problem on the bud, because the student will be pregnant, but there will be somebody out there who will be walking scot-free as either an adult or a co-learner or an educator himself. Yeah. So these are some of the issues that we are currently dealing with, and we are looking at making sure that the policy addresses it so that issue of underage pregnancy is dealt with and it's reported to the South African Police Services so that perpetrators can be dealt with in terms of impregnating underage, those who cannot consent, right, and students who don't have a word in terms of consenting sex.
Because I think that the phrase we should be calling it as, Ms. Mathebula, is statutory rape. If an underage, child is engaging in sexual, intercourse or activity with an adult, that is statutory rape according to the law of this country. With that being said, I know that according to the policy, it places almost the responsibility here on teachers, and that's why some unions have been saying that they're not so sure, they're concerned if teachers will be able to manage, their jobs, which is teaching and, reporting. They even call it pregnancy inspection, which they think should be the role of nurses as well as social workers. Where does this then place, the family unit, the parents, the primary givers, when you talk about this policy?
Absolutely. You will understand that, the policy itself is also looking at the fact that within school setting, there should be a multidisciplinary team. And that multidisciplinary team should be made out of teachers. It should be made out of nurses. It should be made out of social workers who are deployed per schools, so that multidisciplinary team is able to actually tackle the matter as a team, and not only teachers. I think teachers, in terms of identification of a problem, which is a possible learner pregnancy, yes, but I think it should be escalated to either a school nurse or a social worker that is deployed in that particular school, so that it actually takes, or it elevates and it takes away the work of the teacher in terms of dealing with the issue of pregnancy from where it was reported until to where it is supposed to be dealt with.
Yeah.
I think there are a lot of issues that we have discussed as the Gender Commission, both with the Department of Basic Education, but also we have engaged the Department of Health, because we are looking at these issues of making sure that there are nurses that are deployed, whether deployed per school or per a number of schools, and we make sure that those nurses would look at these issues, but they will also look at the fact that there is availability and access to one, contraception, but also access to services that the students or the learners that are pregnant would actually easily access those services when needed.
All right. Well, we have to leave it there. I appreciate you speaking to us about this morning. Ms. Tamara Mathebula, Chairperson of the Commission for Gender Equality. Thank you for your time.